Welcome. I'd like to welcome you this afternoon to the National Network to End Domestic Violence's Congressional Briefing. I'm Dr. Wendy Mahoney, Interim President and CEO for the National Network to End Domestic Violence. Thank you. Thank you. And we appreciate you taking the time this afternoon to be here with us as we roll out something that we find very, very valuable to the work that we do. And so you will hear from some great people today. You will be able to really, really conceptualize the work that we do, why we do what we do, and the impact that we have within communities across the country. And I'll say our acronym, because as you know, the National Network to End Domestic Violence, we say NNEDV, is dedicated to creating a social, political, and economic environment in which domestic violence no longer exists. And I'll say it again. We were established to do all these critical things to have impact, but more than anything, to make sure that domestic violence no longer exists. So as we know that the work that we're currently doing is very meaningful, impactful, but more than anything, is work that's necessary. Founded over 30 years ago, we represent the state and U.S. territorial domestic violence coalitions. There are nearly 2,000 member programs and millions of domestic violence survivors and advocates. That's a lot of people. That's a lot of people. And today, as we are launching our 18th annual Domestic Violence Counts report, this annual report is a snapshot of an unduplicated count taken in a 24-hour period that documents the number of people who sought domestic violence services, the types of services requested, the number of service requests that went unmet due to a lack of resources, and the issues and barriers domestic violence programs face in providing services to victims. We are so grateful, again, that you joined to learn about the latest data, hear from our esteemed panelists, and learn what members of Congress can and are doing to advance safety and justice for survivors. We welcome all of the congressional staff, members of the administration, survivors, funders, press, state, territorial coalitions, local programs, fellow advocacy organizations joining us. We also express our gratitude to the nation's domestic violence programs for all that they do to keep survivors safe every day. The work that they do is vast, and if you are aware of any of the programs or had an opportunity to be a part of in any shape, volunteer or otherwise, the services that our shelter programs provide throughout the country and the U.S. territories is quite meaningful and vital. Why is that? Because the services that they provide to survivors saves lives. At the end of the day, saves lives. And that's critical. When an individual calls a specific shelter program and needs safety, who needs a word, may need a word of encouragement, need resources, a place of refuge, someone who understands it. That's what our programs do. That's what they do. and the work, it cannot even, I think about it, it cannot even be captured most times, even in how we talk about it. Because if you've ever been a survivor, or you've been the one who's needing help, and your overall safety is in jeopardy, you may be in imminent danger. Calling someone and being on the other end of the phone, or meeting them somewhere to get you to safety, you can't even put that into words. As a survivor myself, I say to you, I'm not just standing here as the interim president and CEO of NNEDV. I stand here before you as someone who has experienced abuse. I stand here before you, someone who understands the various systems on all different levels, and the amount of work that we need to do to make sure that individuals understand, but not only understand, put up the resources and supports that are needed to make sure that every individual who reaches out for services has an opportunity to get those particular services. So in saying all of that, please join me in thanking and appreciating the wonderful NNEDV staff who are here, who helped put this together. They're around the room here. I appreciate them. We have our VPs up front. Thank them for the work that they do at the organization. It's something when you can be at an organization and say that you have phenomenal staff who get the work, who are committed to the work. And so I do thank them for all the work that they're doing to make sure that this report, the communication, policy gets out. These teams are great. They have collected and analyzed data from over 1,000 participating programs, developed a report, shared it with policymakers nationwide, and we are deeply grateful to the sponsors of the 18th Annual Domestic Violence Counts Report. Thank you for your bronze support for Element 74, and to our silver sponsor and longtime partner, the Allstate Foundation, who supports this project in so many facets of NNEDV's work. We can't do the work without sponsors. We can't do the work without funding. We all know that. So we appreciate those who help us do the work that we do. We want to thank our honorary congressional co-host, U.S. Representative Debbie Dingell from Michigan, Brian Fitzpatrick from Pennsylvania, Gwen Moore from Wisconsin, and Ann Wagner from Missouri. We appreciate, again, it takes a collaborative approach to do the work and to get things done. So we cannot have that without having those representatives as well supporting the work that we do. So thank them. You know that domestic violence, it's a dangerous situation. And it undermines economic security, it leaves lasting physical, emotional damages, and around 12 million people experience domestic violence every year. And that's just reported. So how many people do not report the abuse that they're going through? It's a problem. And approximately so many receive domestic violence services. Around 1 million receive services. We began conducting the survey 18 years ago to provide accurate information about how many survivors of domestic violence use shelter services without compromising their safety or confidentiality. Our survey date took place on September 6, 2023. Every year, the Domestic Violence Counts Report shares inspiring stories of advocates working together with survivors for safety, autonomy, and hope for the future. And when I think about hope, when you have hope, there's help. And when you have help, there's hope. When you have hope, there's help. When you have help, there's hope. And as we know, hope keeps us in the game. Hope keeps you, okay, I think I can do this. I think it's going to be all right. So our shelter programs are the hope for our survivors. So all of the advocates have many, countless stories that they can share and that they live day in and day out with the survivors in which they come in contact with. So being able to share some of those stories with you. Now, on the day of our count, 1,626 programs of the 2,000, remember I said 2,000, right? So 1,626 programs responded that they provided shelter, housing, and non-residential services like legal advocacy to more than 76,000 adults and children in just that one day. Take it in just one day. Programs shared their survivor stories, which you'll see throughout the report, and here's just one from a Connecticut advocate. The advocate says, a family in our shelter had several housing applications denied because they had an eviction on their record and didn't have income. Our advocate reached out to the landlord to discuss their housing program and emphasize the ongoing support that they provide. The landlord shared her own personal domestic violence experience and approved the survivor's application. The family was able to move to their own apartment and begin their new life. How many others disclose that they're survivors, that they've experienced? But the report also shows that despite their tireless efforts, the advocates and programs supporting survivors simply do not have enough resources. Do not have enough resources. On the survey day, just one local program was able to meet over, and we're looking at this in totality. Now, on this one day, local programs were unable to meet over 13,335 requests for services. 13,335 requests went unmet because of a lack of resources. So what does that mean? That means that an individual and their children were not able to get what? Legal services, transportation, housing, or whatever the specific needs were. While survivors can't access services, they often have no choice but to remain with an abuser and endure further violence. This is unacceptable. So you go for help, and because they don't have the resources, they can't help you, so you go back. How much courage does it take to step out and seek services? Statistics show that before a person actually gets all the way out of the domestic violence relationship, they've tried to leave at least 8 times. So you build up the courage to leave. And I go somewhere and they tell me they can't help me. We're in 2024, that is unacceptable. We cannot turn people away and send them back to a violent situation that could impact them for a lifetime and even end up in imminent danger. We can't do it. We can't do it. I wanted to talk about another impactful story from an advocate in Vermont. The advocate reports a survivor called asking for emergency shelter, but we had to turn her away because we don't have the funding for shelter capacities or staff. We tried to help her as best we could, but she was sobbing and scared for her safety. Let's sit in there. So we couldn't help her, and we left her out there, and we're the resource that's supposed to help. Unacceptable. We are launching this data just as the domestic violence and broader victim services field is navigating devastating reductions in Victims of Crime Act, that's our VOCA funds. As a result, states' programs have been experiencing massive cuts in victim service funding. From fiscal year 23 to fiscal year 24, VOCA funds were reduced by around $600 million. A 30% cut in VOCA funds will force victim service programs to reduce or eliminate services, lay off staff, and in some cases, close their doors. So there is a domino effect to this. As a result, countless victims in crisis will not be able to find help, and you can feel the palpable worry throughout the report. Now, another example from a Minnesota advocate saying intense funding challenges can't match our escalating needs. Our outreach and education offerings have diminished, and our system change work has nearly halted. These reductions impacting numerous lives arise from continued federal, state funding inadequacies. So we know that there's a domino effect when funding gets cut. But the impact is community-wide because people lose jobs. Survivors don't get the services and resources that they need. They're not able to gainfully go back into the community healed and made whole to be able to be free of abuse. Now, for these survivors and advocates, we must and can do better. We must ensure that all programs have the resources they need. Since our last DV Counts report briefing, Congress and the administration have provided record investments in the Violence Against Women Act, which is our VAWA. And we are incredibly grateful for these life-saving investments, but more is needed. Our panelists will provide much more detail on the impact of and what is really going on. And NNEDV's Monica McLaughlin, Senior Director of Public Policy, will discuss the current VOCA funding issues in more depth at the end. Now, we're going to move on to our panel. And we have just been really strategic in making sure those individuals who are coming, and there are many stories out there now. We've already said that we've already, and in our report, you'll see a lot of the advocates, reporting how many survivors got services, didn't get services, but more than anything, it's a whole nother thing when you hear directly from those individuals who are doing the work or who have been beneficiaries of the work to talk about this. So the first person to bring up is going to be Savannah No. She's a member of the Rhode Island Coalition Against Domestic Violence Sisters Overcome Abusive Relationships Group, a Survivors Speakers Bureau. She's a mother of two, and she's currently pursuing a bachelor's degree in human services. But one of the things she said to me is that she wants to be a family advocate. She wants to give back in her community. And she knows what's most important is the collaborative approach, is coming together to give back and to be a part of the solution in our community. And so you will hear from Savannah, her story, what she has done, and how things have impacted her life. Savannah.
Thank you, Dr. Mahoney. Good afternoon, everyone. My name is Savannah. I'm a mother, a survivor, and a member of Sisters Overcoming Abusive Relationships, a survivor task force of the Rhode Island Coalition Against Domestic Violence. I'm here today to share with you why the services outlined in the DV Counts report are vital to victims and survivors like me. As a child, I lived through many forms of abuse. At a very young age, police became involved, and my parents said that if I had told the truth at the time, police would take me away. That's where my fear of seeking help stemmed from. This made me afraid to seek help and lack the confidence to form friendships, play with other kids on the playground, or even speak in front of my classrooms. Throughout my childhood, I continued to be silenced. Eventually, I believed I truly was a problem child and deserved these punishments. At 18, I knew I needed to find a way to get out and find my independence. I found someone willing to let me stay in their spare bedroom. As time passed, feelings grew and we formed a relationship. I felt as though he had saved me. He told me I didn't have to get a job and should focus on my education. He helped me enroll in classes. He even supported me when the work was overwhelming. I wasn't able to see all of the red flags. He would follow me to my classes, scream at me when finances were low, and restrain me in the apartment if I would try to leave. After 2 years, I was able to escape, but found myself homeless and then became pregnant. I ended up living with my mom. I didn't want to live through her judgments and cruel words again. I eventually began a relationship. He was a dad and had a child close in age to my daughter. He seemed perfect. He was involved with his child and even appeared to respect boundaries. My daughter and I moved in after a few months, and a few weeks later, I found out I was pregnant again. Despite seeming perfect at first, it didn't last. We were dependent upon him economically, and I was not on the lease for the apartment. As part of his emotional and economic abuse, he would hold this over our heads. And during the following 2 years, he kicked us out on 4 separate occasions. The first time he kicked us out, my daughter's pediatrician connected us with a community caseworker. In January of 2020, I started applying for housing, and I cautiously asked my caseworker if what I was living through would be considered emotional abuse. I was surprised when she said yes. She told me no one can rush a victim into accepting that they're being abused. It was at this same time that I decided to start looking for shelter before things had the chance to get any worse. A month later, I finally found a shelter that had enough space for us, but we had no transportation and the shelter was about 20 miles away, and still I knew I had to make it work. I didn't know what to expect, but I was welcomed with warmth and reassurance when I walked in. During the intake process, this amazing advocate kept telling me my story broke her heart and I'd do big things one day because of it. I was scared and worried about how my kids would adjust. It was still a rough transition, having to administer nebulizer treatments to my infant every 3 hours, trying to entertain my toddler, and worrying about the repercussions of leaving. After about a month, COVID-19 shut the world down, but the shelter director was still there every day, spending countless hours working with families to ensure they still had all they needed. At the time, I thought all I needed was shelter and help finding a home. But our time there taught me some of the most valuable life lessons. She helped me to understand the impacts of generational trauma and work on making positive changes in myself. Each holiday we celebrated at the shelter. Each milestone my children hit, the staff ensured it was special. As a mother, I felt like I wasn't doing enough for my kids, but the amazing staff saw so much more in me. During our time there, I learned about healthy relationships. After 25 years of being silenced, I learned that I was valuable, that speaking out matters, and it makes a difference. After 7 months, we were approved for transitional housing services and moved into an apartment. I was terrified about handling everything in my family's lives alone, but I learned how resilient I had become, how to trust others, and recognize when I needed help. While in transitional housing, I found out I was denied for subsidized housing. My advocate worked with me to file an appeal, and after only 3 months, we were in permanent subsidized housing, just in time for the holidays. Around this time, my abusive ex-partner reappeared in my life, promising to be a better dad and partner. I wanted to give him a chance to show that he could do better, but it was only calm for a few months. Before I knew it, he was back to saying and doing hateful things. Things escalated physically. I sought the support of an advocate once again, and this time we filed a police report. She continually assured me that I was doing the right thing. I was able to get assistance to apply for a housing transfer under the Victims Against VAWA Act housing protections, and within a month my family moved into a new apartment. These advocates helped me to see that the longer I stay quiet, the less change happens. For a while, my abuser continued to stalk and abuse me, but with the support of the advocates and social workers from other programs, I was able to create a safety plan, and I had the courage to speak up. It is thanks to these services that I have found my voice and I'm able to be here today. Without services, too many people will go unseen and unheard until it's too late. I am fortunate that I was not only able to access these services, but truly gain from them. 10 years ago, I couldn't stand in front of a high school class to make a presentation. But I'm here today in front of you because I've had the privilege of working with so many advocates who helped me see that no one's voice should be silenced. My children and I still have housing, community connections, and the peace of mind that we're safe. Alongside my advocacy for domestic violence, I've also begun advocating for the schools, coaching youth soccer, and have been able to return to school. And now I'd like to introduce Kritika Ghosh.
You see what services can do. Well, we will have a little break right now in our program. You know, we just flow how it needs to be. I want to say that I said it earlier, but we cannot do the work without champions. We cannot do the work without individuals such as Representative Debbie Dingle, who is one of our biggest supporters and champions in the work, and she launched and co-chairs the bipartisan working group to end domestic violence and is a lead sponsor of key legislation addressing gender-based violence. I'd like to welcome Representative Debbie Dingle.
I hate interrupting, but we're in a markup all day. You know, we're doing really important things like laundry liberty. Truthfully, that's the bill that I just left in committee. I really want to thank the Network to End Domestic Violence for bringing all of you together today. And this is it's a subject that we've got to take the stigma off of, that we've got to talk about it in real terms, and I'm feeling I never know how I'm going to feel or what I'm going to say, anybody who knows or works with me, because it's hard. But we are in the House of Representatives in the last 24 hours dealing with a horrific case of domestic violence. And that Representative Kildee of Michigan, my colleague's nephew, shot and killed his nephew, he shot and killed Dan's youngest brother, his father, yesterday, as part of domestic violence. What I know all too well, and what some of you all know too well, that when someone gets out of control for whatever reason, he was involved in his nephew, who was, after he shot and killed his father, stole his father's car, was in a horrific car accident, and is now in the hospital in serious condition. It started out in the morning with a domestic violence scene at the home at 2 a.m. And the mother and father became involved. And maybe this will shine a light a little more. I know what it's like to live in that household. And I didn't talk about it for many, many years. People tried to blackmail my husband, who preceded me, and I had my own career. They tried to blackmail me. My father was a drug addict, a prescription drug addict, you know, all the things we don't talk about. He was very paranoid, and he could snap like that. The presence of a gun in the house was not a good thing. And there was more than one night, and I would gather my brothers and sisters, and we would hide in the closets and pray to God that we would live through the night. My mother ran from the situation, probably the night that was the most horrific, where I grabbed the gun and kept them from killing each other. I was in 8th grade. My father took the handles off in the lock, all the doors, so nobody could get in and out of our house. I called the police, and no one came, because my father was an important man. And we don't like to talk about it. We don't think it happens in all kinds of households, and it does. And too many feel trapped. My mother stayed. My mother's still alive. She'll celebrate her 90th birthday in 10 days. And I do praise God. And I try not to, I look at her sometimes though, and I try not to, I love her. And by the way, that's one of the reasons that I don't talk. I think the death yesterday has me saying more than I do sometimes. Because she's still alive. And it's not just my story, it's the story of my siblings. My youngest sister, baby sister, who started 1st grade that morning after my father and mother almost killed each other, and we were left in a home with no help, was never okay. She ultimately died of a drug overdose. People feel trapped. People feel like they can't escape. They don't. And by the way, in those days there weren't resources. Law enforcement didn't respond. We have come a long way. Not far enough, but we've come away from when I was young. I'm not old, I'm seasoned. When law enforcement wouldn't respond. And I want to say these are the most dangerous cases that law enforcement responds to. And there are a lot of women that aren't in the horrific situations that I lived in, or Dan's brother dying. But they're beaten, they're mentally abused, they're physically abused, they're financially dependent, and they don't know where they can go. And one of the worst things is children who are trapped in that family situation. We have to take the stigma off. We have to, we got Bauer finally reauthorized, and too many shelters, too many people that were helping people didn't have the resources because it took too long to even reauthorize it. But now that it's reauthorized, we have to make sure that we are putting the money into the programs that people need. We also have to put the human face in it. We should not have a Supreme Court case that if someone is a convicted, went through due process of domestic violence, that they should not be able to have access to a gun. And as all of you know, the federal court in Louisiana overruled that, and it's now at the Supreme Court. A gun in the presence of someone who was mentally unstable, and I know the mental health groups don't like me saying it, I lived it, so don't tell me not to say it. I know what it is. We have to talk about these issues. We have to make sure resources are there for people. We need to make sure it happens to men. It happens to more women, but it happens to men and women. No one has to stay in an abusive situation. We need to be the voices for those that cannot be the voices. We've got to tell them how they can find the resources, and we have to make sure we are getting the resources there. And not only law enforcement, who I know are now responding, and not every place, but are, and that the justice system treats these cases fairly as well. You know, when someone goes out and gets a protective order, it takes too long to put the we just had a case in my district this year, or it was last year, but where a woman had gotten a protective order, nobody had put it in place yet, and she was shot and killed. We got to do all this. We got to be the voices. So thank you for being here. Thank you for being the voices. Thank you for fighting, and we're all in this together. Thank you very much.
Thank you again, Representative, and thank you for sharing. We connect with stories. We connect because it's real. The stories I have, when I literally had flashback moments when she said that. Remembering my mother grabbing me and my younger sister and going into the bathroom with a knife in her hand and scissors in her pocket. So when I say that I'm here and what I'm talking about is real, I've experienced it, I understand it. And many people don't know where to go, what to do, or how to get out of it. We do have to talk about it more. We need to be more aware in our communities of what the resources and supports are. But I could go on, it's not my show, so let me move on. Our next, we have two additional people on our panel. And so Kritika Ghosh is the Executive Director of the Asian Pacific Islanders Domestic Violence Resource Project, which is a mouthful, DVRP. With over 20 years of work in gender-based violence, she comes to this work as a queer immigrant survivor of gender-based violence. She has a vast amount of experience. She's committed. She started many programs that are outstanding. She has outstanding accolades around her work on ending gender-based violence. You'll hear from her, and after Kritika, you will hear from Hema. And Hema is the Deputy Director of the Jane Doe, Inc., the Massachusetts Coalition Against Sexual Assault and Domestic Violence. So I won't go into all that. Hema she's there, a lot of accolades and stuff as well, but to save on a little time and let you hear from them the work that they do and the commitment that they have. Next, Kritika.
Thank you, Dr. Mahoney, and I just wanted us to give another round of applause for Savannah and for sharing her story and her So, as Dr. Mahoney mentioned, my name is Kritika Ghosh, and I'm here in my role as the Executive Director of the very long-sounding name, Asian Pacific Islander Domestic Violence Resource Project, which I will henceforth call DVRP, for abbreviation. And I'm here as a survivor myself, as a queer immigrant survivor, to talk to you about the needs to support the work of culturally specific organizations, and particularly those working within Black, Indigenous, people of color communities and those serving immigrant and refugees. GVRP supports and mobilizes Asian Pacific Islanders to build safer communities by responding to harm and striving to end gender-based and power-based violence. And we've been around since 1995, and we're based here in the DC, metropolitan DC area. We serve clients and survivors from the DC, Maryland, and Virginia areas. And we've been at the forefront of providing culturally competent, trauma-informed, and survivor-centered services for our API communities in this area. in this district and beyond. Sometimes we have folks calling us from cities and states that don't have an Asian Pacific Islander organization, or even internationally. We are an organization that's founded by and run by members of the API community, and it's survivor run as well. And we acknowledge that we have intersecting identities, and that the need to respond to these, to our community using a complex and comprehensive response. Our values and guiding principles include a commitment to our community and to survivors, empathy to each other and to clients, and a justice-based anti-oppression framework in which we do our work, centering our community and developing safety in our community, and collective liberation for all. We participated in the 2023 Domestic Violence and NNEDV Domestic Violence Counts report, and we've been doing so for years. And sometimes, actually, we are a very small organization. We are less than 10 staff members, and when we are asked how many people did you serve a day, sometimes those numbers could be not exactly huge numbers, but it's because our work is more intensive. So even one case can take years and years. So we don't have a timeline when it comes to survivors who come to us for support. Our work is critical in our local community as the only pan-API serving organization providing support to survivors through case management, mental health supports, economic empowerment work, and community outreach and education. And during the pandemic, we saw a huge shift in, a lot of the organizations saw an increase in calls. What we noticed was also an increase in the kind of violence situations that people were experiencing, and it included anti-Asian violence, which increased during the pandemic. So we noticed that statistics show that about 61% of those impacted by anti-Asian violence were women, and many of them had intersecting experiences of violence with gender-based violence as well. Last year, we served 244 clients from all around the DMV region. I'm sure you know what that is. And also countries including Afghanistan, Bangladesh, Burma, Myanmar, China, Egypt, Philippines, India, Indonesia. Well, I could go on and on, it's the UN, but you get the idea, from all over the world. Most of our clients are limited English proficient immigrants who face different forms of social isolation and intersectional systemic violence, including sexism, racism, Islamophobia, and discrimination based on immigration status. Therefore, the standard responses of domestic violence and definitions fail to capture the complexity of domestic violence in our communities, resulting in notable gaps in health and mental health services, including domestic violence and sexual assault services. Our services have included case management, mental health therapy, poverty alleviation through a flex fund, economic justice work through referrals for job training, education resources, and referrals for legal representation and advice. Our commitment to providing tailored and culturally sensitive and linguistically supportive support continues to be a cornerstone of our work. And what makes our work unique is the two-pronged approach to gender-based violence, which includes both direct services to our hotline and our intensive community outreach and engagement work, because it's important to respond to the immediate needs of a survivor. But I've been doing this work, as I think Wendy mentioned, for over 20 years, actually 25 years now, and it's increasing and increasing. How do we shift things so that we see a change in beliefs and behaviors? And that requires much more investments in our communities through doing work and talking about these issues. So our outreach and training team provides community education workshops and trainings, develops free multilingual accessible toolkits and resources, leads healing spaces, and conducts outreach to API communities in the DMV, and builds relationships with other organizations. Our healing spaces includes cultural modalities of healing, including comic book creation, trauma-informed photography, storytelling, chi breathwork cleanse, and an altar building healing space to commemorate the anniversary of the Atlanta shootings, where 6 Asian women were ruthlessly murdered. Last year, we celebrated the 10th anniversary of our annual Artists of Voice event, which is a survivor-led space to share performance and artwork. Hannah C., one of our artists at the event, shared the following. Being both an Asian American artist and a survivor, there are rarely spaces that can safely acknowledge both of these identities sort of simultaneously. DVRP did an incredible job making sure everyone participating and attending were comfortable. With my healing journey, it's been difficult finding ways to share my story within the limitations I have to live with. but art has been such a strong tool for me to reclaim my power. API survivors' unique cultural context also reduces their ability to disclose violence and seek help due to gender norms that make discussions of abuse and sexuality taboo, and discourages survivors from challenging abusers and disrupting families, even when their lives may be at risk. Other complexities within API communities include the perception that violence is a family matter and that seeking outside help brings shame to the family. APIs that leave their spouses or partners risk being ostracized from their entire community and support system. Experience in their countries of origin often cause APIs to mistrust uniformed authorities, preventing them from seeking help from police or utilizing the court system. Because they have been isolated by their abusers, many APIs are not knowledgeable about resources available to them, and limited English proficient survivors of domestic violence and sexual assault are among the most likely groups to encounter problems in accessing services. So sometimes we're told that, why can't a mainstream organization just hire an Asian person and respond to their needs? First of all, we're a very diverse community, and secondly, you need to have a culturally specific tailored response to gender-based violence. One of the key ways in which we create our programming is through the use of listening sessions, which is a space for survivors to come and share their experiences and opinions on a variety of topics, including the impact of anti-Asian violence in Montgomery County, Maryland, transportation needs during the pandemic, and the impact of the pandemic on their financial well-being, mental health, and more. And these have resulted in our creation of a robust mental health and economic empowerment programs and partnership with Uber that provides survivors with rights to their appointments, and a research report as well as programs responding to anti-Asian violence. All of these exciting and innovative programming that I mentioned are possible through financial investments in our work, including funding from WAVA, VOCA, OVW, FIPSA, and ARPA grants, which are all federal grants, and some funding from foundations. Oftentimes, culturally specific organizations such as ours have to struggle to get this funding because of a lack of understanding of the specific needs of our organizations that we fill. Not having access to culturally specific organizations can lead to BIPOC and immigrant refugee communities and members isolated, and it can lead to greater harm, including death due to gender and power-based violence. While we are deeply thankful for federal funding that we receive, further investments in our work would lead us to being able to provide housing support by allocating for flexible funding to assist survivors with their housing needs. We would also be able to afford legal support, which is a considerable challenge for survivors. And we would be able to help them navigate the legal system with less stress. If we had more funding, we would also seek to establish a legal program with an in-house attorney supporting our clients. So there's definitely, when people ask us what, Monica asked me, what would you do with more money? We have a whole report I could send out. The work that DVRP and our sister organizations around the country does is essential to ensure that the most marginalized in our community have access to safety, security, and the support to heal and to rebuild their lives. I leave you now with a quote from one of my favorite authors, Arundhati Roy. Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. So you are all a part of that new world that we all seek to build together, and I hope that we get there someday. Thank you for your time, and now I will pass it on to Hema Sarang Siemiński.
Afternoon. Thank you so much to all of our speakers and to the survivors who've shared so much. My name is Hema Sarang Siemiński, and I'm the Deputy Director of Jane Doe Inc., Massachusetts Coalition Against Sexual Assault and Domestic Violence. Our work at JDI, as we call it, is intersectional and really founded upon a belief that safety and justice for survivors demands attention to the broadest needs of survivors. So these are needs that demand that we address economic and housing security, access to safety and justice through our courts, bodily autonomy and human dignity, education and prevention, and racial equity. We center the needs of survivors and apply this intersectional lens in all that we do with our members and the public. But I'm here today just to highlight a couple examples of the powerful work of our 60-member programs across the Commonwealth of Massachusetts as they support survivors of domestic violence and sexual assault every day, and to reiterate the importance of federal support for these survivors and services. Our programs provide shelter, including hotel and motel stays, housing, healing-centered support, legal services, children's services, mobile advocacy, bilingual advocacy, culturally specific services, and so much more. We in Massachusetts are deeply grateful to a state legislature that invests robustly in domestic violence and sexual assault services and support for survivors. But even with this reality, programs in Massachusetts use a variety of public, private, local, state, and federal funds to meet the needs of survivors. And the impact of cuts on programs is dire during a time when we all know that the needs of survivors are increasingly complex. Last year, during the DV Counts Day, Massachusetts domestic violence programs served over 1,100 survivors in a single day. And on that same day, there were 463 times where individuals and families requested services but were turned away for service, with nearly half of those requests related to safer housing and or emergency shelter. We are in a housing crisis in Massachusetts like so many other places. Some of the most chronic needs of survivors continue to be economic and housing security, with far too many survivors unable to access that safer, affordable, longer-term housing that is so critical to survivor safety. But in Massachusetts, VOCA funds have shored up the ability of programs and advocates to provide necessary survivor-centered services to meet the growing needs of survivors. I'd like to highlight the work of one of our member programs, On the Rise. On the Rise works with unaccompanied adult women, trans, and non-binary clients from Greater Boston who are homeless or formerly homeless and need a level of support and services that many mainstream programs simply can't provide. The vast majority of these unhoused women and gender-expansive people are survivors of trauma and abuse, predating their homelessness. And the links between homelessness, poverty, abuse, addiction, and mental illness are very well documented. On the Rise's VOCA program provides free support and advocacy to victims who face barriers to other services because of their multiple needs. These VOCA advocates connect with victims at a drop-in center to provide basic nutritional support, hygiene support, safety needs, while receiving flexible support to address issues related to trauma, addiction, mental health and physical health, domestic violence, sexual assault, access needs, immigration needs, legal problems and poverty. This is the kind of comprehensive work that some of our member programs do. And without something like On the Rise's VOCA program, these survivors who are at such intense need would be left behind. I'm gonna, in the interest of time, talk about, the services that our programs provide really embody what we call survivor-centered approaches to meeting survivors wherever they are and whatever they need and present in tangible and accessible ways. That is the core driving force of so many of the advocates who do this life-giving work. I want to talk about what's at the heart of these organizations, and they're really at the heart of these organizations are the individuals who provide these essential services, and they are advocates who work tirelessly to ensure survivors get the care and support that they need. At JDI, we are beginning to dive more deeply into the needs of sexual assault and domestic violence, the service provider workforce. This sector disproportionately employs survivors. We are the largest employer of survivors in the sector. And so we're acutely aware that our work to sustain services and support for survivors must be in lockstep with our efforts to respond to the similarly complex needs of the sexual assault and domestic violence workforce. The DVNSA service sector needs consistent funding to pay a living wage and maintain its survivor-led workforce, which in turn improves services to survivors in active crisis. As I said at a recent advocacy day that we held in Massachusetts, when survivors lead, we can win. We can access the resources that we need to support one another. I want to talk a little bit about some of our systems advocacy work. Though the DV Count report captures direct services our members provide, our advocacy to improve system-wide response to survivors might not be as evident. And in 2023, JDI members began a deeper collaborations to understand the responses of our court systems for survivors seeking protection. So from everything from how the courts are laid out, to the demeanor or training of court staff or judges, to the trauma-informed practices of various stakeholders in courts, we're engaging in a multi-partner effort to identify what helps and what heals when survivors attempt to seek protection in our courts. And so together this work is part of our commitment as a coalition to celebrating what's working and to providing roadmaps as to how we can grow to ensure that our courts are as accessible to survivors as possible. So whether our member programs are providing life-saving and life-giving services to survivors, unfortunately in the past year or so, many have had to cut the level of intervention services that they're able to provide. Others continue to live in the anxiety of how further loss of federal funding may result in personnel cuts in the months ahead. We are overall so grateful for the strong support for services for survivors and urge Congress to continue to invest in the necessary services provided by the Victims of Crime Act and other federal funding streams so that programs in states like ours can continue to be resources for all. And I just want to thank you all for all of the work that you do to support survivors.
Everybody. My name is Monica McLaughlin, and I'm the Senior Director of Public Policy at the National Network to End Domestic Violence. Again, such a great panel. I want another round of applause. So, I know that we're at time, so I won't keep you for too long, and lots of the pieces of paper that greeted you here on your seats give you all the information that I would really tell you. It's just I think the main takeaway at the moment is we're sort of overwhelmed by how many folks are turned away from our shelters on any given day in our services. So what's in your locus of control, right? If you're a congressional staff person, there's lots that you can do to really elevate these programs throughout the appropriations process. As we look to fiscal year 25, we have the opportunity to close the gap in the Victims of Crime Act, which is facing a gigantic cut this year, absolutely massive. So as we heard earlier, VOCA was cut by $600 million. That's a 33% cut. And as I've said before, that if you cut 33% off a belt, you simply cannot tighten it. This is dangerous for survivors, and so for congressional staff, I think looking for those Dear Colleague letters, making those congressional requests, really clamoring and making a lot of noise about the Victims of Crime Act and related funding in this year would be so important to us. If you could do that, that will help move the needle on funding VOCA this year and all the related services. And look, we have so many congressional champions, our honorary congressional co-hosts for this briefing, and so many others who are really fighting the good fight and really elevating the needs of survivors. So we feel very grateful for that. It's going to take a lot more. It's going to take a lot of political will. It's going to take a lot of pushing of leadership and others to really make sure that we can't let the VOCA cut be sustained and just let more and more survivors be turned away from services. I'll leave you with one quote as we close out. Do remember that you have all this information in your packets. There's cookies at the back. I don't want to be remiss in reminding you of that. But a quote from one of our state domestic violence coalitions. So they said, to our leaders, we ask that you advocate for your victim service providers as loudly as we advocate for the lives and futures of your constituents and for the children of our state. That you be agile, resourceful, responsive, and working toward a permanent and long-term sustainable funding solution. That you help the helpers, so that we may be able to continue to help the victims and their children and survivors, uninhibited, unafraid, and without wavering. With that, thank you.
Thank you, Monica. And so, Monica is the expert on this. So if you do have questions, information in your packets, you need some things explained a little bit more, little tips or anything, she is the go-to for that. Thank you again to the panel. Thank you for our champions, and for being here, taking your time out to be here with us today. Again, thank you, and we appreciate you, and have a great rest of your day.